We are ready.
Well, welcome to our learning session today. I want to thank everybody from the bottom of our hearts for taking the time to participate with us on this inaugural ISOP session here. My name's Jeff Goldhagen. I'm a pediatrician in Jacksonville, Florida, and president of the International Society for Social Pediatrics. And so again, I want to welcome you. It's a pleasure to have you all with us. And this, again, this is our inaugural attempt at establishing and using Zoom to reach a global audience with respect to particular issues that we're very committed and concerned about. So this is the beginning of a series. It's a 8-session series over the next 8 months on addressing the impact of climate change on children. And as all of you know, climate change is the most important existential issue and human rights issue that is affecting children globally. And all of us who are physicians and or child health providers, no other discipline really will bear witness to the extent of the impact of global climate change more than us. So as health professionals, in many respects, we have a profound and unique responsibility to address climate change, and in some ways, a unique opportunity to, in fact, respond. So towards that end, ISOP, which is the International Society for Social Pediatrics and Child Health, has committed itself to catalyze and sustain a global movement among child health professionals to address the issues of climate change, to harness the voice of children and the ingenuity of children and the energy of children and youth, and link that to the experience and knowledge and commitment and passion that we have as social pediatricians and child health providers to address global issues. And over the years, and ISOP is 40 years plus old now, ISOP as an organization has committed itself to addressing issues of global concern to children. As you can see in this first slide, climate change is a critical issue that we're addressing. But we're also committed to address those social and environmental determinants of health that, again, are the root causes of the critical issues that children are experiencing all around the world, both children who are marginalized and vulnerated by poverty and other social determinants of health, as well as children and youth who are living in middle and higher income countries. So as an organization, we've committed ourselves to deal with issues like migration and refugee issues. We're just finishing 3 years of addressing issues related to the impact of violence on children, poverty, emerging infections, environmental issues, and so on. But over the next several years, what we have done is committing ourselves, or what we will be doing is committing ourselves to the issues of climate change and the impact of climate change on children. One of the things that we're going to be doing is introducing a organizing framework of planetary pediatrics to hopefully galvanize and organize our approach to these issues, using the byline that planetary health is child health. And to move forward, we need all of your involvement. We need your expertise. We need your experience. We need your passion. We need your compassion. We need all of us to join together if we're going to succeed in the way that we hope that we can succeed, because, again, this is an existential issue, and in fact, we don't want to think about what the world might be like if we don't succeed. So this learning session, again, is the first of 8 sessions. We're learning as we go along, and our experience then will help inform other sessions as we move forward. But we're looking at these not as just didactic sessions. We're looking at this as an opportunity to really think strategically and work strategically. So that after the didactic session, there will be breakout sessions. And so far we have around 15 different breakout sessions that are divided up primarily by region. And what we ask for you, we would really very much like for you to be able to take the time to join one of those breakout sessions. Uh, in the breakout session, there will be a moderator, and the moderator will ask questions, moderate the discussions. And then after we're done, after you're done, then the sessions will all be recorded, downloaded, and then come back to us to be able to collate the discussions and distill themes, and then take those themes and put those themes together into what we hope will become a strategic plan, a global strategic plan for child health professionals to address and mitigate the issues of climate change on children. So before I finish, let me just take a moment to, again, thank you all for joining us. We hope that, well, we know the presentations will be superb, and we're sure the discussions will be illustrative as well. And again, we need your participation. Let me thank our scientific committee from ISUP. I'm not going to name them all, but they have worked really arduously over the past year or more to put this program together. Initially, we were going to be meeting in Indonesia and had actually, before COVID hit, already planned for that meeting. And I want to thank our Indonesian colleagues for the time that we've spent together prior COVID, and know that we will be back in Indonesia as soon as we have an opportunity to do so. The platform and the Zoom meeting is being implemented by the University of Florida Department of Pediatrics. And I want to thank them and Miguel Perez for all of his work, and Tina Smith, who's on the Zoom call too, here for their work as well. I need to thank Eva, my daughter, for all of her organizational and administrative work, and for being tolerant of those of us who are not nearly as tech savvy as she is, with all the questions we've asked over the last several months. And I want to thank our moderators who have stepped up to the plate, so to speak, to really take a lead role in making sure that that our sessions work and are recorded, and that we're able to capture all of the insights and knowledge and experience that people hopefully will be sharing. In some ways, COVID has separated and isolated us in ways that we could never have imagined. But in other ways, this Zoom session being an example, it's brought us together in ways that we could not have imagined. And so, again, we thank you. We hope that this platform and that this process will be successful, and we're pretty sure that it will. And that you invite us, that you join us rather, for subsequent sessions. And we'll be sending out flyers each month to make sure folks know that what the session is going to be about. And we ask you to disseminate that as widely as you possibly can, and hopefully we'll be able to enjoy your participation in the future as well. Please know that once you registered for this session, the link that you received will be the same link for each of the sessions in the future. But we would like for folks to register for each of the sessions so we know how many people will be joining us, so that we can have the requisite number of breakout rooms available to accommodate people. So let me finally finish by introducing Nick Spencer. So Nick will be taking it from here. We'll be introducing our speakers, and we'll be moderating the didactic component of the of the session. Those of you who know Nick know that he needs no introduction, but those of you who don't know him should know that Nick is one of the most important people globally in advancing the discipline of social pediatrics, not only from his organizational skills in helping to build ISOP as the previous president, but also for his contributions for research on child health equity in many domains, and his role as an educator and mentor over the decades to ensure that, in fact, the rights of children are fulfilled, in particular those rights for survival and development and health and health care. Again, it would be great if you could join us on our journey. We would love for you to join ISOP. The link to ISOP's website is there. It's pretty simple, isop.org. We're going to be going this year to an all donation framework for membership. So there's no requisite amount of funds that are required to join ISOP. Please join us as a member and donate as much as you can, which will be much appreciated. And together, our voice is far stronger than we are singly. And the challenges that children and youth are experiencing globally are extensive, they're growing, and we need everybody's voice in order to be able to succeed. And with that, let me turn it over to Nick, and thank you all again for joining us. Bye-bye.
Thank you, Jeff. Am I coming up, Miguel? Yeah. Okay. Oh, well, I can see everybody now. Well, welcome everybody. And just to follow on from Jeff, it's a real pleasure for us to have you all with us. My job today is to moderate the presentations. We are extremely privileged to have the team from UCL and from Lancet Countdown. They are going to present as a team effectively, and Marina Romanello will be presenting first. Marina is a data scientist and research fellow for the Lancet Countdown, and she's going to be talking about the data that underpins the issues to do with climate change. She will then be followed by Alice Magushin, who is the program manager for Lancet Countdown and is a pediatrician who trained in Australia, and she will be talking about the issues to do with process and how how areas are dealing with the issue of countdown of climate change. Sorry, and then finally Tony Costello will be talking on the future for children, and particularly focusing on an initiative which is called CAP 2030, which is children in all policies in 2030. Okay, well, without further ado, I'm going to ask Marina to start the presentation. Marina.
Awesome. Thank you so much, Nick, and thank you so much, everyone at ISOP, for organizing this. Thank you, Jeffrey, as well. I'm going to try to share, to put it in presentation. Do you see the full screen there?
Yes.
Yeah, awesome. Thank you so much for having us. For us that work on climate change and health, it's just so inspiring to see this meeting on this webinar at ISOP happening with so many people attending. So thank you so much for organizing it. As Nick said, I'm the data scientist for the Lancet Countdown, and I'm going to present a bit of what we do at the Lancet Countdown and a few of the key indicators on that show what the health impacts of climate change are. But because I know this is the first seminar, I thought that it would be good to start from the beginning and talk a bit about climate change and where we are, where we're heading. So I don't need to tell you this, I'm sure, but since the pre-industrial revolution, the industrial revolution in pre-industrial times, CO2 emissions have been increasing year on year around the world, mainly driven by the burning of fossil fuels, but also having to do with cement and with ruminant livestock that also contributes to greenhouse gas emissions. And greenhouse gases, particularly CO2, have a long half-life, so they accumulate in the environment. And what they do is they retain the heat from the sun, and that leads to our atmosphere starting to get hotter and hotter. And today we're roughly at 0.8 degrees of warming globally on average with respect to pre-industrial times. So just about in 100 years. And we're already seeing, as the pictures that Jeffrey just showed, the big impacts of climate change in our environment, extreme weather events, droughts, floods, and quite extreme events as a result of these environmental changes. And perhaps the concerning news is that the IPCC forecasts that even in the most ambitious and probably unlikely mitigation scenarios, the world is still going to keep on warming up until the end of the century, reaching anywhere from 1.5 degrees in the very, very most ambitious scenarios to anywhere around 4 to 5 degrees of warming by the end of the century, which could have catastrophic consequences to our environment and the systems that sustain us. So why are we talking about climate change to a pediatric audience? Climate change is having direct and indirect impacts on our health and the foundations that our good health depends on. It's leading to extreme weather events in terms of storms, drought, flood, heat waves, extremes of kind of wildfires. And those obviously affect directly our health through direct injuries. They also lead to mental health and to loss of well-being in general. But climate change is also starting to affect the systems that sustain us through indirect effects. It's putting pressure on our water quality and our water security. It's starting to put our health systems at risk and risking gains in terms of nutrition and food security that we've made. It's also changing the environmental conditions, which changes ecological niches of infectious diseases. And we're starting to see infectious disease patterns changing around the world, putting at risk health systems that are prepared to work under certain stable circumstances. And both direct and indirect effects are obviously mediated by our social dynamics. Climate change is also starting to affect the social fabric and the systems that sustain us. It's starting to affect the provision of services. It puts at risk our health provision, our sanitation. It's also starting to put at risk our economic security through increased economic losses and all the kind of well-being consequences that that has. And the most concerning bit of all is that the people most affected by climate change impacts are those that are the most vulnerable, those that cannot take care of themselves, including very young children, the elderly, the urban poor. And in that sense, climate change is acting as an inequality multiplier, exacerbating pre-existent inequalities and leading to the breakdown of our social fabric. So climate change has been tagged like the biggest global health threat of the 21st century, but tackling climate change is also the biggest health opportunity of the 21st century. And that is because a good mechanism to tackle climate change will lead to cleaner air due to the reduction of fossil fuel burning, will lead to healthier diets that are more plant-based and with lower carbon footprints, and will lead to healthier lifestyles and a reduced reliance on fossil fuels for travel. So apart from preventing the health impacts of climate change, obviously the mitigation of climate change would create a healthier lifestyle and healthier conditions for children growing in the world today. So with that quick introduction, I wanted to present today, let's see if it passes. Oh, one behind. The work that we do at the Lancet Countdown. And the Lancet Countdown is, in essence, a big research collaboration. The central team is based at UCL, where Alice, I, and Anthony Costello work. But we are a big research collaboration with 38 partners around the world, from leading academic institutions and UN agencies. And we have over 120 collaborators that go from climate scientists to economists, social scientists, medical scientists, health professional mathematicians. And annually, we produce a report ahead of the UN climate change negotiations. And this report has over 40 indicators that we track year on year, looking at every aspect of the interrelationship between climate change and health. So we look at indicators on the health impacts of climate change, on adaptation and adaptation for health and of health systems, what climate change mitigation does for health and what are the co-benefits of that mitigation for health, what are the financial aspects of the transition to a healthier economy, and social and political perception of climate change as a public health issue. So when we talk about climate change, the first thing that comes to mind in general is extremes of heat. And exposure to extremes of heat will affect mostly the elderly, the urban poor, those that cannot take care of themselves, and very young children. Young children are at greater risk of electrolyte imbalance, fever, respiratory disease, and kidney disease as a result of extreme heat exposure. What we do at the Lancet Countdown to track extremes of heat is looking at over 65s. It's a population that our data allows to monitor more easily than very young children, but we know that the trends go in the same direction. And what we see in elderly populations is that in 2019, there has been a record of almost 3 billion additional days of heat waves experienced with respect to a baseline of the 86 to 2005. And as you can see in this graph, exposure to heat waves is increasing around the world. These are short events of very, very acute exposure to very extreme heat that can have an enormous toll on young children and those with underlying health conditions or the elderly. And through another indicator, what we try to model is what mortality due to exposure to extreme heat looks like around the world. And what we see is that only in the last 18 years, from 2000 to 2018, we've seen an increase by over 50% in the mortality related to heat, reaching almost 300,000 deaths annually. But heat is also, as I said before, affecting the systems that sustain us. And one of the effects of heat is that when crops, and particularly the crops that we depend on, the staple crops that our global food security depends on, are exposed to high temperatures, these crops will mature more quickly than normal. And as they mature more quickly, they will yield smaller seeds. So what we're tracking with this indicator is what we call the crop yield potential, the maximum potential of crop yield that our environmental conditions allow for. And what we're seeing is that for every major staple crop, the crop yield potential is reducing strongly around the world. In most cases, this reduction in crop yield potential is not translated to effective crop yield reductions yet, because we have a lot of technology and a lot of investments put in agricultural production that mitigates part of these effects. But the concerning thing is that it will affect mostly the most vulnerable, again, those populations that do not have access to international food markets, that do not have the economic resource to buy technology for their agricultural production, and therefore depend on their local systems and on stable environmental conditions to grow their own food. So climate change, again, is putting at risk our food security, and I don't need to tell an audience like this one that food security has the highest impact, the strongest impacts on children as they're growing, has irreversible impacts on their development, causing stunting, severe wasting, and mental impairments as well. One other consequence of the changing climate, both of the temperature and of the precipitation patterns, is that the ecological conditions are changing for pathogens around the world. So what we're seeing is that the ecological niches are changing. And what we try to track here is what the environmental suitability for the transmission of different infectious diseases is around the world. Vector-borne diseases, foodborne diseases, waterborne diseases, and earthborne diseases are all very sensitive to environmental conditions. So what we're tracking here in particular are 3 diseases that we think are particularly relevant. One is dengue, is one of the most rapidly increasing diseases in incidence around the world, and its impacts are particularly strong on young children. It has the worst cases in young children. We track malaria. That is a condition that is, a lot of efforts are put into controlling, and they have so far been quite successful. And we track also Vibrio bacteria as an example of waterborne diseases that can cause quite dramatic skin infections. There's the flesh-eating bacteria as well as gastrointestinal infections from vibriosis. And what we're starting to see is that from 1950 to 2018, the environmental suitability for the transmission of dengue by the Aedes mosquitoes is increasing around the world. We're seeing for Aedes aegypti, globally on average, almost a 10% of increase in the environmental suitability, and for albopictus, a 15% of increase. This is in part what is driving the increase in the spread of dengue around the world. We have modeling that shows us that this is part of the driver of the increase in transmission of dengue. And we're seeing more and more that dengue is moving to new latitudes. It's starting to shift further down in South America, it's starting to spread also in Asia. In terms of Vibrio, we're also seeing that in those places that have brackish waters, where we're modeling them, there is also an increase in environmental suitability in the waters for the transmission of Vibrio diseases. And places like the Baltic now have warning systems asking people not to bathe in waters when there's a high risk of vibriosis. What we have seen is that the coastline that is suitable for transmission of Vibrio has increased by 61.2% in the Baltic since the 80s alone, and by almost 100% in the Atlantic Northeast in North America. And malaria transmission is also increasing, particularly in highland areas, not so much in areas where you have endemic malaria. There the pattern is changing. But what is concerning is that we're starting to see very suitable conditions for malaria in highland areas and in countries that did not have before suitable conditions for malaria transmission, which means that even more and more, we're going to start seeing these diseases showing up in areas where we're not used to having it and where we consider we were shielded from them. And all of these infectious diseases obviously have the biggest toll in children when they get exposed to them. And as an example of kind of the extreme events, obviously wildfires were a lot in the news. If someone remembers what pre-COVID times were, the 2020 started with the Australian wildfires, and the Californian wildfires after that had a huge impact. And climate change is starting to favor drier conditions and warmer conditions that predispose to wildfires occurring. And what we're tracking with this indicator is looking at the risk of the climatological risk of wildfire. And what we see is that in the period of 2016 to 19, as compared to the early 2000s, in 114 countries, there was an increasing number of days that people were exposed to very high wildfire risk. And that this has translated to an increase in exposure to wildfires in 128 countries. This obviously leads to direct injury from exposure to the wildfires, lung and heart conditions from the exposure to the wildfire smoke, but also economic losses and losses of the essential infrastructure that we need to have functioning for our systems to work. In our 2019 report, one of the biggest conclusions, this is again pre-COVID times, but one of the biggest conclusions that we had is that because of the impacts of climate change in every aspect of our life, the life of every child born today will be profoundly affected by climate change throughout their lives. When they're young, through food insecurity, through infectious diseases, as they start growing older, through their labor capacity, their capacity to work under extremes of heat, exposure to extreme weather events, and then in old age again, heat affecting the elderly and exacerbating underlying health conditions. So unless we take accelerated action and accelerated interventions, climate change will be the defining factor for the life of children, and it will affect them throughout their lives, from early on, defining what their health will look like. So this is my very quick introduction to the Lancet Countdown and the health impacts of climate change. Alice will tell you more about the work that we do, but in case you want to look at some of our indicators and the data behind them, you can visit lancetcountdown.org, and we have a database platform there. And obviously, I would be happy to receive any questions after Alice's presentation. Thank you, everyone.
Alice, do you want to go straight in?
Yes, I'm happy to. Now, I believe you can see my screen. Let me just put
Yes,
it on
yes.
full screen.
Yeah, we've got your screen.
Perfect. And you can see the presentation now.
Yes.
Perfect. So thank you very much. I am going to move straight on to the response to the health effects of climate change. And I'm initially going to start with the broad response of in terms of adaptation and mitigation and how they relate to health. And then I'm going to look more specifically at the response among health professionals, and then even more specifically, the response among young people, among children and adolescents. So a lot to cover in a very short space of time, but I imagine all of the things that I'm going to raise now will be covered over the next 8 weeks. So as a broad overview, the response to climate change falls into 2 key areas: adaptation and mitigation, which is reducing greenhouse gas emissions. At the Lancet Countdown, we are particularly interested in adaptation, planning and resilience for health. And with mitigation, we're particularly interested in the interlinkages with climate change mitigation and health. As Marina mentioned in her slides, the relationship between changing our energy sources, changing our fossil fuel use, and the reductions in air pollution, changing our diets to reduce agricultural emissions and the improvements in health outcomes for that, and changes in our use of transport, for example, increasing our walking and cycling, which is increasing our physical activity and the health benefits of that. So the next 3 slides, I'm going to present a few of our indicators looking at the different responses to the health effects of climate change to really take stock of how we are going currently. Firstly, key measures to reduce climate change related health hazards are national adaptation plans for health and also assessments of climate change related health risks. The World Health Organization surveys countries on their progress in these 2 areas, and they found in 2018 that 51 out of the responding 101 countries reported that they had a national health and climate change plan in place. And then 48 countries indicated that they'd also conducted a national assessment of health vulnerability to climate change. However, governments have identified that financing remains a key barrier to implementation of these plans. Looking briefly at mitigation, fossil fuel use across all sectors contributes to about 73% of total global greenhouse gas emissions. Therefore, coal phase out and its replacement with renewable energy is both an essential step in the response to climate change and an important intervention to reduce morbidity and mortality from air pollution. Whilst power generation from wind and solar is increasing rapidly, the share of wind and solar of total power generation remains low at only 6.5% globally. And the rate of growth of wind and solar needs to continue at a similar rate to what it is now in order to displace fossil fuels. And to date, the rate of growth has not been enough to change global energy emissions. For example, the carbon intensity of the global primary energy supply has remained the same for the past 3 decades. We've not yet reduced emissions in global primary energy supply. Moving on to another key sector, the food system is responsible for 20 to 30% of global greenhouse gas emissions, and most of this originates from meat and dairy livestock. Overall emissions from livestock production have increased by 16% since 2000 to more than 3.2 gigatons of carbon dioxide in 2017. Ruminants, so that's looking at cattle, as well as sheep. They contribute to 93% of total livestock emissions and 56% of total agricultural emissions. And from them, non-dairy cattle contribute 67%, which identifies a key target for both reducing greenhouse gas emissions and also benefiting health, because the reduction in red meat consumption reduces cardiovascular disease, as well as some cancers and type 2 diabetes. Looking forward, the 3 indicators that I've just presented in the 3 previous slides tell us that we're currently not on track. We're currently not doing enough to respond to climate change. Looking to the future, this figure is from the annual UN Environment Emissions Gap Report. Now, UN Environment states that countries must collectively increase their national ambitions 3-fold in order to be on track for a 2-degree temperature limit by the end of the century. And they must increase their current ambitions by more than 5-fold to be consistent with 1.5 degrees of warming. So there's a lot more that we need to do. So with that in mind, what does that mean for us? What does that mean as the health community? And what can we do to engage in the issue and to make sure that global greenhouse gas emissions do reduce rapidly enough to limit global warming to 1.5 degrees? So firstly, we need to produce the evidence. Our indicator here on coverage of health and climate change in scientific journals tells us that research in health and climate change is growing. However, there is unequal distribution in research. Most of this research is looking at high-income countries and impacts, whereas we know that the greatest impacts are in low and middle-income countries. We need to engage policymakers. Now, this is just a slide of the different health associations that we worked with in 2020 to produce national briefings for policymakers, where they produced a 4-page brief taking our indicators and creating recommendations based on national level data. We need to engage the media. Now, media coverage on climate change and public health has remained fairly low, and that's the blue line that you can see in this figure. However, there have been substantial increases from 2018 to 2019. Of course, looking at 2020, we expect the results of coverage both on climate change and on climate change and health to be very different compared to previous years. We also need to take action on climate change in our own sector, looking at the health sector, both through mitigation and through adaptation of the health system strengthening. Globally, the health sector contributes to around 4.6% of total global emissions. Last year, the National Health Service in England announced its plan to reach net zero emissions for its direct emissions, so that's its health service provision, by 2040. And for its indirect emissions, for example, looking at pharmaceuticals and medical equipment, by 2045. It published a report in October with this announcement, as well as an article in the Lancet Planetary Health. And this can be used to guide other health systems in their own mitigation efforts. Fewer doctors get involved in direct action, but these actions also play a key role in raising awareness on the health effects of climate change and the need to act now. And these can force the hand in terms of decision making. So we've seen more and more of this with Extinction Rebellion, but in Australia, this was taking place several years earlier. For example, the bottom 2 photos show actions happening by doctors to stop progress of the Maules Creek coal mine in New South Wales in 2014. So moving from health professionals to children and adolescents and how they are acting as agents for change themselves. I'm just going to present a few short slides on this because we don't have much time today, but children and adolescents have been responding to the crisis for decades. Almost 3 decades ago, in 1992, 12-year-old Severn Suzuki spoke at the first climate change conference, the UN climate conference in Rio de Janeiro, telling the world leaders, if you don't know how to fix it, please stop breaking it. Moving forward, very similarly to Severn, in August 2018, 15-year-old Greta Thunberg and other young activists sat in front of Swedish Parliament, which became an action that mobilized over 14 million people in 7,500 cities across every single continent. These are just some photos of some examples of these. During the COVID-19 pandemic, the youth climate movement did not stop, but adapted with online protests and community organizing through Zoom, such as what we're doing now. Children and young people have also been involved in climate change litigation cases against government. In 2015, the Dutch government was obliged to reduce greenhouse gas emissions in proportion to its share of the responsibility. This was a decision that was upheld over 2 appeals by the government. From 2019 to 2020, there were litigation cases filed in every single continent, and there was a legal complaint by 16 young people before the UN Committee on the Rights of the Child against the states of Argentina, Brazil, France, Germany, and Turkey. And in September last year, 6 Portuguese young people aged between 8 and 21 took the first case of its kind to the European Court of Human Rights, alleging that the 33 European countries had failed to enact the emissions cuts needed to protect their futures. So children and adolescents are involved in a whole lot of other work as well, including engaging with negotiations, disaster preparedness, education of themselves and of other generations, as well as building their own skills for a green economy. But we can't expect them to do everything. They feel that they lack adequate support in a range of areas, including mental health, chronic illness and disabilities, finance and education, and the greater transition before independence when approaching adulthood. They are frustrated that climate change is not a top priority in many places and that competing economic and invested interests are jeopardizing meaningful action against the climate crisis. And they want transparency in communication about climate change policies, and they want to be included in the decision-making processes. So on that note, I'll give the stage to Anthony, who will talk about the importance of children in all policies. Thank you.
Whoops, what have I done?
You shared your whole screen. Your whole.
There, is that it? Okay. Whoops. Let's move that down and let's play it. Have you got that?
Yes.
Great.
Yes, we have. Yeah.
Okay. So, I mean, I've never given a lecture really where you start by saying, is there actually a future for our children? And if so, what are we going to do about it? I mean, when I joined WHO 6 years ago, it was clear there were 2 big strategic needs for WHO. One was to redesign child health materials to the new epidemiology that had moved on since the early 1990s, where everything was geared towards malaria, diarrhea, pneumonia. You know, what about maltreatment, asthma, and the like? So we set up a child health redesign group, and they're still working. But we also realized that to really tackle the increasing burden of environmental issues, and particularly climate change, there needed to be an approach that brought in a way to address children outside of pediatrics and health ministries in all policies. And so we set up a commission, which we called A Future for the World's Children. Well, we didn't call it initially, but we wanted a commission that was very multidisciplinary, international, brought together people from all over the world. And this was one of our meetings. We've had two, one in Dhaka, Senegal, and one in Beirut. I think that's the Beirut one, actually. And the first thing we did, which I think was a really good thing to do, was to get two very influential and active chairs. And we were lucky because the first two we invited were Helen Clark, former Prime Minister of New Zealand, who doesn't need an introduction, and Awa Sek, who was the Minister of State for Senegal, previously been Minister of Health. And unlike a lot of chairs I've worked with in the past, they actually read everything. They join phone calls. They come up with really interesting things. And I'll just quote one thing that Awa Sek said at the first meeting. She said, I've spent 10 years sitting in cabinet in Senegal, and it's taken me that amount of time to persuade my colleagues that the way to develop our country is not for rapid economic growth by any means, but by investing in children. And we have to emphasize that continually. So we set this up with them. They've been fantastic. We realized that progress on the whole SDGs had stalled. Many of the 2 billion people, or more than 2 million people, live in fragile states, cursed by conflict, and of course, all the burgeoning problems of climate change. And many countries are not reporting data on child-related SDG indicators. Indeed, SDGs have a PR problem because there are 17 goals. And, you know, that's crazy because I bet most of you can't, if I said what's, you know, hid the screen and said what's SDG 12, you probably wouldn't know. So I think, you know, it is an issue, but in another sense, it's incredibly important because we've got to make this next decade is absolutely vital if we are going to protect the future for our children. And we know this kind of stuff comes out of WHO. So environmental exposures have a massive effect throughout your life course. And at least a quarter, some would say more than a third of deaths in children come from environmental effects. So, and we know this, that, can you see all my screen or are you seeing me at the top like I am? Is that okay? You can see the whole, okay. So, I mean, we know that the first 1,000 days are absolutely critical, that it's going to affect the child's life chances in all kinds of ways. So having a good environment, clean air, healthy diets, clean water is vital at this time. And we know from James Heckman, the Nobel Prize winning economist, that you get major returns for, you know, if you want to translate everything into economics, the more you invest early in the life course, the more the return you're going to get. And I think as social pediatricians, we all have a great instinctive understanding of that importance. And this is important, that children need protection. Look at every sector. So take transport, it's the leading, road injury is the leading cause of death in children aged 5 to 29. Agriculture and trade needs no, you know, of course, food policies are important. Urban planning is central for play areas. Air pollution exposure is absolutely massive in most urban settings, particularly in South Asia and increasingly in Africa, but everywhere. London has an air pollution problem and it has all kinds of knock-on effects. And we know, whoops. Ooh, why's my slides not going on? Hang on. Ooh, I have. How do I get out? I can't even. Have I moved my slides on at all? Can you see it?
No, you haven't. Miguel, can you help? Have we got?
Can I escape from?
Have we
Yes,
got
you should be
Tony's
able to hit the
slides that we
escape
can?
button.
Well, what I was also going to show you about family services. I think crucially about housing, which Helen Clark was extremely strong on, that 40% of the world's children do not have access to safe housing, and education is absolutely fundamental. Now, all of these things are absolutely critical to address climate change. And if I have got frozen, I better just continue from memory. But just to say, the big message from this commission, there were 5 main messages that came out. The first was about national leadership and institutions getting behind an approach that places children right at the center of the Sustainable Development Goals. This is not, you know, oh, well, children can benefit from it. Children are the crucial element of the Sustainable Development Goals. Secondly, and this sounds really boring, multi-sectoral development. We can turn that into language that people understand, which is building coalitions for action. And we found it absolutely essential that we reach out across sectors to bring about change. Thirdly, climate change, which is enormously important. And that's why I was very keen after we published our commission, which came out a year ago in the Lancet, and you can download a free copy, to link this to the climate futures, because the two have a huge area of overlap. Fourth, we came up with, and you'll have to look at this, unfortunately, I think for some reason, my computer is frozen.
Can you, are you able to unshare your screen?
I've been trying to do that, but unfortunately.
How about now? Does that stop it?
Yes.
Okay,
Yes.
So when you go back to your share screen, go ahead and share your entire screen and not just the PowerPoint. And that should free it up.
Shall I share? So when I go back to
Go to share screen, and then at the top left it should say screen 1 or screen 2, whichever you'd like to share.
Yeah.
And then hit your share button.
I'll leave it at that at the moment, because
Okay.
it might be safer to do that. So I've said placing women and children at the center. Oh dear. Okay, I'll click on. I'm going to jump over that. You can read about the benefit cost ratios of investing in all manner of child health. I've said about multi-sectoral action. I've said the importance of acting on climate, which goes without saying. And of course, as Alice and Marina have both said, children have played a central part of really energizing people with this wonderful phrase from Greta Thunberg, our house is on fire. That's a picture of Australia after the wildfires. And we wanted to show this through a child flourishing and futures profile. And we said, look, you can look at children in terms of whether they're flourishing or not using SDG indicators, but let's look at countries according to the damage that they're doing to children's future. And so you can see here that the countries that have low child flourishing index, which is the x-axis, you know, like Chad, Somalia, Central African Republic, they are sustainable. They're not damaging the future. Whereas all of the countries which boast that they're flourishing are actually damaging the future for all children. I've picked out a couple there, but all of the major wealthy countries are doing that. We also jumped on the issue of protection from commercial marketing, which we think is not only huge, but growing. And of course, with social media, is targeting children in a way which will always increase consumption through their lifetime, which of course is a major contributor to climate change. And this is just to show that we're working as one element of the follow-up to the Commission to really try and regulate this through an optional protocol added to the UN Convention of the Rights of the Child. And it's not just alcohol and junk food and sugary drinks, it's also problem gambling, because gambling is being absolutely targeted at young people around the world. But I just want to finish by talking about what we're trying to set up now. We've spent the last year trying to get money, a little bit like the Lancet Climate Commission, which has now been running successfully for 10 years. And we have got some funds to get us going for a year, which is then going to be hopefully multiplied by the same funder, but hopefully by others. And the idea is that, again, it will be WHO, UNICEF, Lancet. UCL is just the secretariat, where we've got basically 2 people who are helping us set this up. But we want to work with our existing commissioners and new people from around the world to particularly focus on cross-sectoral ideas and initiatives that could then go to scale fairly rapidly. So in Argentina, Raul Mercer, who's a leading member of ISOP, is setting up a network on children's rights around Latin America. In Ghana, we're working with a very dynamic NGO with links to policymakers on early childhood development. In South Africa, Mark Tomlinson and Tanya Doherty and Asher George chose alcohol as an issue, which has a lot of, they discovered during COVID actually that they had to introduce bans on alcohol because of the whole limitation on hospital beds, and it absolutely dropped trauma and violence across South Africa, particularly in affected areas. We're working with Nepal on using adolescents to collect data using citizen science methods to build climate resilience in rural areas and linking with leading policymakers there. In India, we're discussing a new project with urban planners to make urban planning more child-friendly, and in Pacific Islands, working with indigenous peoples to look at ways to strengthen their ability to be both climate resilient and also good for children. In France, we're hoping to do some work on the mental health of adolescents, and in Senegal on social protection. And of course, in the UK, we don't have anything at the moment. And I hope that given the rise in destitution, which has happened during the pandemic, also allied to the climate threats to the UK, that we will develop something going on here. And critical to all of this is country ownership, local ownership, and adolescents being given a voice, because it's their future and they need to have a say in it. And I don't think we've done a good job on that yet. And I'll stop there because I think that's the fight. There's one other. Oh yeah, I'm just giving you my Twitter feed. But it's been a pleasure. I really think ISOP could be an invaluable partner in this kind of move ahead. And I hope you'll discuss that in the breakouts. I'll stop there. Thanks.
Thanks so much, Tony. And thank you, Marina and Alice, for those excellent presentations. We've been taking, questions have been arising in the chat, and very helpfully, Alice and Marina have been answering some of them. We have a couple of questions for Tony that he will not have seen because he was talking. And one of them was, and there's a question for the panel from Barbara Rubio. During the strict lockdown period in the first wave of COVID-19 pandemic, we witnessed how gas emissions dramatically decreased to such a point that one may consider it was a wake-up call. This would have been a great opportunity to bring awareness and action. Why haven't governments grasped this opportunity and start making a difference? Do you want to talk about that, Alice, maybe? Or
yeah, absolutely. A key reason why governments haven't grasped that immediately is because of the cause of that drop in greenhouse gas emissions. So in 2020, we did see a likely drop of global greenhouse gas emissions of 7%, which is enormous. But the reason why emissions have dropped by 7% is because we're dealing with a global pandemic, which is a global crisis. And so, of course, there are two crises going on at once. There are multiple crises going on at once, but that time was not the time to be able to talk about the ability to kind of reduce greenhouse gas emissions to that level, whilst we are also dealing with overwhelmed health systems, etc. And of course, the other thing is that it's the messaging around that reduction in emissions. We cannot say that the reduction in emissions that happened in 2020 were a good thing, because they came at the expense of now almost 2.5 million lives. So, but what we can say is that with our recovery to the COVID-19 pandemic, that now we have an opportunity to reset, because the pandemic has disrupted everything related to our way of life, to the way that we consume, to the way that we travel, etc. And we're going to have to, governments around the world are going to have to put in trillions of dollars to recover from this pandemic. If that money goes towards the right type of policies that are aligned with the Paris Agreement, with mitigating climate change, and also with system strengthening, with health system and agricultural system, etc., strengthening, then this response, the recovery to COVID-19, could be a really good opportunity to respond to also the crisis of climate change.
Thank you, Alice. Can I just say that we've overrun time a little, but we can eat slightly into the breakout room times. And the breakout rooms can actually go on longer than an hour. I mean, the people can continue to discuss in the breakout room, so can use up that extra quarter of an hour. Lucy Reynolds from Scotland has raised an issue: greener parenting at societal, not individual family level, includes reducing commercialization of childhood, not raising super consumers. Do you want to address that, Tony?
Yeah, I think this is a massive issue. And look, every child in the world almost gets online at an early age now. Not quite everywhere, but most kids do. And the big companies and a lot of satellite companies that sell information to them, I'm talking about Facebook and Google particularly, they hoover up all information about the children. They can work out their ages, their background, their gender from algorithms and stuff, their local economy, what their likes are. They get every bit of information about them for free, no privacy, and then target ads at them. And this has exploded. That's where all the advertising is now. It's not in the telly, or very little compared. Well, it is on the telly, but it's not the same as, and I agree with you. I think this is a mass move towards getting our children to consume the rest of their lives. So I absolutely, and that's fundamentally linked to climate change. And it links to another question there about, why haven't we used the COVID crisis to learn to live more, with falling emissions? Well, emissions, I think, have only gone down by about 7%. It's not an absolutely massive fall. And what's disappointing is for the first time in Delhi and Kathmandu, you could see the horizon. You could see the Himalaya. You had blue skies, not gray mists or fogs. And yet, going back, it's just gone back to how it is before. Not quite, but almost. And I think what worries me is that, as James Lovelock said, humans don't seem to have the capacity to recognize the dangers more than about 2 or 3 years ahead, and politicians don't, because a no growth economy, which has been raised, seems to not have much of an electoral advantage. So I think we're in deep, deep trouble, and we have to learn a way to change things. And we've all got to do that. And we shouldn't be traveling to conferences anymore. I know we all want to go back to it. It's great to meet people, but this is a better alternative.
Yeah.
I'll stop.
Yeah, you've answered the question, Tony's question, which was about growth and whether government should be abandoning the whole idea of continuing growth. A message, that one, I'm not sure who that one was from, but as pediatricians, can we learn how to reduce our use of plastics despite infection control enthusiasm for one-use everything? Who would like to address that?
I can talk a bit to that if you want, based on our experience with the NHS decarbonization that we have been working with for quite some time now. And obviously, anything that has to do with health system has to be done very carefully, ensuring that you never stop protecting health and you never stop delivering the high quality service that you need to. But the NHS in England has done quite a bit of nice work in trying to study how to reduce waste and how to reduce single use from PPE to kind of single use orthopedic devices. And plastics come into that. And they have done an analysis on the use of single-use plastic for the clinic and for the operation room, and actually using steel-based instruments and autoclaving them and sterilizing them, if it's done properly and with proper control, is as secure as using single-use plastics and single-use devices. So there's a lot to be learned about kind of resource use, and particularly during the pandemic, the use of PPE and the way that we were using PPE, and we need to use PPE, has exposed the big crisis that we have in consumables and how the supply chain is so vulnerable. So prioritizing the use of the essentials from the supply chain, minimizing the use of single-use devices as much as we can really help lower the toll on our essential supply chain as well as the waste production. So yeah, there's going to be some publications coming throughout the year on the reduction of waste from health systems that the NHS has been working on. And that's quite an interesting analysis they've done.
Thank you. I'm looking for some of the other questions and having difficulty finding them now. Eva, can you find another question for me, or can you ask it? Because I'm a bit lost now in all these chats.
Sure. There was one just sent that says, do we need to change the economic models and assumptions to reduce consumerisms and capitalisms, like donut economics, and considering meeting needs within planetary boundaries? How else can we reduce poverty and inequalities and allowing children to thrive without harming the planet and their future?
Yeah, I mean, I completely agree. And I mean, people talk about green growth, and of course, there is some truth in that, you know, we can have growth in renewables and in much more zero carbon industries, but ultimately overconsumption is going to do for us. And that's why we have got to move into a much more equitable distribution of resources. You know, the COVID has revealed the true nature of social inequalities in every country. I mean, look at in the UK. I could talk about the UK. It's been a disaster, and we have hungry children. We have 500,000 households in destitution, and this is true around the world. And we need a new economics, which is about equity and about enjoying the good things in life. And I've learned, I mean, having traveled too much in my career, I've learned, you know, sitting here in Yorkshire, how important fresh air and clean environment is. And I think we've got to learn that. And if we don't, we're going to pay, our children are going to pay a terrible price. And I think we have to, you know, come off the kid gloves with our politicians and put absolute pressure on them as much as possible to take decisions, but also within our own professional groups by setting an example.
There's one other, thank you, Tony. There's another interesting question which came, I think, quite early. Should we be linking more effectively with veterinary medicine in these efforts and aim to reduce use of antibiotics and pesticides in animal care and agricultural practices. I think, Alice, you had, did you talk about that, I think, or Marina? Or one of you want to come in on that, veterinary medicine?
Yeah, I can talk a bit to that. I'm sure Al can as well, because she's from the medical community and she knows her antibiotics. Absolutely, the One Health approach in that sense has quite gotten the right views on it. It's undeniable that we're very closely linked to the natural environment and to the animal environment as well. And both from the point of view of infectious diseases that come from wildlife, like we're seeing the devastating effects of COVID, from the excessive use of antibiotics, from the use of pesticides, is undoubtedly one of the determinants of our health, how we're dealing with the kind of the veterinary side of things. And we do work with a bit of veterinary experts and people looking particularly at vector-borne diseases that do look into these things. But I do think that we have to do a lot more as a medical community to interlink with the One Health approach, trying to connect more how our health depends on the natural environment that sustains us and how we cannot be dissociated from veterinary medicine as a discipline either, particularly when we're using the same types of antibiotics and oftentimes we're impacted by the same types of diseases as well. I don't know, Ali, if you want to add a bit more about that. But yeah, definitely more to do.
Okay, thank you very much. Well, I think we're probably going to need to move on to the breakout rooms. I want to first of all just say how grateful we are to our speakers for an excellent introduction and to the whole issue, to a series of issues related to climate change, and particularly, I think, this idea of children in all policies, which I think is a very powerful concept, because children are often marginalized when it comes to policies, and governments pay relatively little attention to the issues to do with childhood and children. I'm going to say, I think everybody can now consider moving into the breakout rooms. Each of the breakout rooms will have a moderator. There are, and you can choose your breakout rooms if you click onto the icon right down at the bottom. That there's one next to record, and then breakout rooms, then reactions. So if you click on breakout rooms, it brings up a whole series that you can join. Can
I just interrupt for 1 second before?
Yes, of course.
Before people break, just to let you know that the recordings will be archived, the presentations will be archived and be on the ISOP YouTube channel. So there have been some questions as to whether the slides would be available and so on. So they will all be archived there as well as the chat.
Okay, great. So you'll see from the breakout rooms what is possible, what you can get into, and now it's changed on mine to unassigned. Okay, so just to say that the next seminar, the next learning session will be on the 26th of March, on Thursday, the 26th of March at the same time. And we really encourage everybody to register for that and to join. And that's on understanding the science of climate change, which Kevin Anderson will be presenting on, and also the launch of the ISOP Declaration on Climate Change and Child Health, which Ruth Etzel will be will be launching. So if people would now like to start moving into their breakout rooms and have a good discussion, remember, moderators, please remember to record the sessions.